Okay.
Welcome, everyone. Like I said, my name is Alicia Rogers. I'm a member of Purdue's small ruminant team, and we welcome you to our Lunch and Learn series for November. Today we have Dr. Kirk Hubbard with us talking about small ruminant first aid. So thank you, Dr. Hubbard, for being able to join us today. And as we go along, would you prefer to have questions answered as we go along or just at the end?
At the end should be fine. I'm
Okay,
at hopefully 20 or 30-minute kind of conversation, and then we
okay,
can kind of go from there, okay?
perfect. All right, I'll keep track of the questions for you.
Perfect. Thank you.
All right.
Okay, guys. Well, my name's Dr. Kirk Hubbard. A little bit about me on my slide here is I grew up in Bright, Indiana. It's a small town outside of Cincinnati, Ohio. I was a 10-year 4-H member um, in the Dearborn County level, did all that. I have goats still to this day. My family shows and raises dairy goats and travels nationally with them. As you can see, I've known goats since I was a little one up here in that photo. Through my 10 years in 4-H, I went to Purdue for my undergrad and bachelor's of science, and then went to Ross University School of Veterinary Medicine for my veterinary medication degree, and I graduated in 2019. After that, I'm currently actually working at a 24-hour emergency care clinic in Hawthorne Animal Hospital in Glen Carbon. They see just strictly small animal, but I still do a lot of small ruminant care via kind of second parties as well as with my own herd back home. So this is just kind of a little timeline of me. This is our one of our kind of more famous does, Crunch. She was a national champion, and then I actually met my fiance, who is working also at the same clinic as me, down at the bottom, Melissa. An overview of kind of today. What we're going to talk about is just first aid cases in general. I'm not trying to make any of you guys surgeons. I'm just trying to help deviate between what should be emergency versus potentially, something we can take care of at home. Um, Also, we're going to be setting up a first aid kit. Again, could be some basics or it could be advanced depending on our clientele and also the comfort level of you guys. Also, we're going to talk about some herd management to prevent some of these first aid causes, as well as overall nutrition. Like I said, some limiting factors of the first aid aspect, closed versus open herd, as well as the Haemonchus scorecard. And then kind of at the end is more of just hopefully kind of leading into our questions about what is a treatable via the owner standpoint, or when do I need to make an actual a phone call to the veterinarian. So types of first aids we see is the first one is kind of the one that the horror story, dog fights, wolves, coyotes, wherever you're living at, they get in the pen and they run amok. Obviously, those are types of emergencies that we need to get to. Then we start dealing with puncture wounds, disbudding concerns, long bone or fractures of those bones. Those are definitely, I would say, they vary. And that's kind of this topic is a little bit overview of those things, as well as kind of going down to the next one is infections, where we see abscesses. As what those can be caused by some sort of fungal, bacterial, or viral component. And then the final one is parasitism, and that just kind of is what we see with a lot of herds now. It's like poor doers are the ones that are just not growing; they're just kind of plateaued in their younger years from that standpoint. So this is kind of a catch-all slide. I'm gonna probably spend a lot of my time on this slide alone. This is just items for first aid kit. So people that don't have first aid kits, get a sheet of paper, write it down. Um, Everyone's a little bit different. It also depends on our goals and also just depends on what we're trying to get with our herd. I could be talking to people that travel nationally, like my family, or we can just be talking about the couple goats in the back 4-H project. This still applies to everyone. And that would be basically having some sort of dressings like bandages, gauze pads, such like that. If we have like those, types of wounds that we need to stabilize en route to the veterinarian, or if the veterinarian's coming out. Honey is kind of, it's on here more of as It helps with healing. It adds a lot of secondary granulation tissue and can help promote healing factors. Mostly it's kind of after the vet visit or something like that. That's kind of when we start talking about putting honey as a dressing down. Betadine is for those small little nicks, wounds, small lacerations, that we can have on hand in our tool shed or in our uh, box at home. Clean towels go a long way, really, from a standpoint of kidding. It goes to wound care. Really, just having a nice stack of clean towels definitely helps. Triple antibiotic ointment is more of just the aspect of going back to that betadine, those little lacerations that we can easily take care of, and really can help with just kind of the minor wound care. Epsom salts definitely help with like foot rot, kind of pulls that abscess out and those types of issues if we're having those aspects. Baking soda down here is actually probably my number 2 on the list. I love baking soda, especially with small ruminants. It helps with decreasing bloat. Really, with baking soda too, you can have it free choice. At our farm, we have actually little food creep feeders that we have tacked up on the wall, and baking soda is in one of them, and they love it. And it just kind of helps regulate that rumen and keeps uh, chances of bloat decreased. Also, in general, it is a treatment for bloat if it's not too severe. Now, if we have a severe bloat, obviously medical intervention may be needed, but kind of that beginning milder stage, definitely baking soda can help. Bandage scissors, hoof trimmers are kind of self-explanatory from that standpoint. Kara syrup is probably number 3 on my list, and that helps with it's a basic sugar, and really from the standpoint of that sugar, we can use it in kidding and lambing where we have a poor kid that's not doing well. It's a fast glucose, kind of pips them up, gets them going. Also on the flip side with our pregnant does that just lambed or just kidded, putting that in some 5-gallon bucket of warm water and having them drink that really can have them get kind of revitalized and get them off the ground a lot better. My number 1 item for every first aid kit needs to be a thermometer. 100%. It needs to be there. Nothing I wouldn't say frustrates a veterinarian more than an owner calling and being, hey, my goat's not doing well. Normally the first question out of every veterinarian or large animal veterinarian is, what's the temp? That tells me a lot already on the phone. And also, if you have that information for the veterinarian, that can really save a lot of time of kind of phone calls back and forth, or from a standpoint of the veterinarian aspect, we're normally seeing some other client or we're en route to another farm call, and if you call the client like, hey, or you call the doctor and like, hey doc, I got a goat that has a 104 temp, this is what my signs are, that can already kind of get our minds thinking down the road of kind of what treatment wise and such from that. So having a thermometer, I can't stress that enough. I definitely don't want to beat it to the ground, but it is something that it's something easy to do. It's an easy gathering of information for the veterinarians that, if they are at the clinic, they can, you say, hey, I got 104 temp, great. Normally the veterinarian will try and, get to your clinic or get to your house as soon as possible, or bring that animal to the clinic as soon as possible, because normally those high temperatures are some sort of, or even low temperatures are severe from that standpoint. Colostrum down here, this is just more of having it. There's powdered form. There's also milk replacers. Colostrum for the first 24 hours, making sure that those kids and lambs get off the ground, get nutrition, get all that stuff going. It's nice to have some powdered form. I know some people freeze it and such as well. There's been some controversies with freezing can kind of denature some of the proteins, but the powdered works very, very well, and really helping that aspect of, if your doe or ewe isn't producing or maybe has a complication during pregnancy and unfortunately doesn't make it or doesn't produce any milk, having that, in your kind of milk room or in your parlor definitely helps, and mixing up a bottle and feeding those guys so they can get those antibodies and get that active immune system working. The next kind of These points down here are more for talking. We need to talk to our veterinarian and get a plan, because sometimes, if we have a bunch of goats or a bunch of ewes, then I would see, hey, let's work something out with your veterinarian to get this in your first aid kit, because we might be able to cut some corners from that standpoint. And these would be dewormings. There's two classes. I normally like having two classes on hand. One would be fibinazole and the macrolides. This is basically Panicure, and then the macrolide is like your ivermectin. And that basically is for deworming of internal parasites. The kind of gold standard is to use one a year and then switch out and use, kind of rotate these, because we do have resistance in our small ruminants, and that's something that's unfortunate, but doing these kind of rotations definitely help. Syringes and needles, again, if we are talking to our veterinarian and we're comfortable doing that, great, let's have them in there. If we're not, then that's something we need to have a plan set up with our veterinarian of, hey, we need this type of medication, we have that fever. They can run out and give some, Banamine and kind of help drop that fever as well. And then kind of the final two down here are more of herd management injections. CD&T vaccine is kind of our gold standard vaccine. It is kind of our core vaccine. That's what we need. It's Clostridium and tetanus, and that is key for our younger ones, and also is good to do with our older does annually. Bose and Probias are more supplements. Bose is vitamin E and selenium. That helps with joints, and kind of, especially with our younger ones, it prevents white muscle disease, and it is something that we like to do with our younger ones, as we'll talk about later. And then Probias is more of it's a probiotic, and it helps with if we have some rumen issues, giving that. This is probably the least invasive of having needles and syringes on board. Probias is more of, you have that doe or ewe that's not eating very well, or not as thrifty, you kind of squirt some down its mouth, and it kind of gives a little bit more, as we kind of, the bad terms, I guess, of veterinary medicine, bugs. It gives some good bugs, and kind of promotes those good bugs in the rumen from churning about. Down here are some visual aids from, I just kind of stole these from Utah State, and also just kind of Hoger supply of just basic first aid kits. This is also with small animals. I mean, a lot of our farms have cats and dogs on them. So it is something, just kind of be, on the lookout if we are treating our large animals and we have small animals around and potentially they get into medication. Let's make sure we separate those, or if that does happen, we kind of keep an eye on them. Really, from a standpoint of what I didn't have up here is the udder ointment, and the udder ointment in general helps with early stages of mastitis. If we have that kind of red inflamed udder, it can help kind of calm that down. It's not a sole treatment. We would definitely need some antibiotics and such from calling your veterinarian and whatnot, but that is something I would say have on hand, just as a first line of a defense from that standpoint. Other than that, kind of run-of-the-mill, flashlights, pins, veterinary contact info. You wouldn't, I hate to say it, people go on vacation and things do happen, so it's nice to have that for whoever your care sitter, your pet sitter is, that they know, hey, I can call doc so-and-so, and they know what's going on. Those are great information to have. That is on to the next one, and this is basically herd management, and that's the key. I think really a lot of those kind of, that first slide of the bacterials and the virals and the fungals can be really eliminated via good herd management. Dog fights and coyote attacks are unfortunate, but that is something that you can't really predict or prevent, besides I would say having good fortune. And so going to the nutrition is really key here, and that's based off of our age, our goals of our herd, as well as the seasons. You're going to be feeding a lot more in the winter than in the summer, just based off of keeping these guys heated and the energy levels so they can thrive in these types of conditions. I know Illinois gets pretty cold here, as well as like the Midwest. So those are going to be different feeding routines than someone sitting in Florida or California. So that's varies from each herd and operation. So kind of beginning with our kids and lambs, what we like is high quality grains, high quality haze as well, because they're just new after they're weaned off the bottles and the milk. They're getting that rumen developed, so they need some really good high quality energy to kind of keep going and keep churning, because these guys are supposed to eat, sleep, and grow and basically repeat from that standpoint. I like having some sort of additive to our feeds, and that could be decox or rumensin. Those are coccidial statins, and it basically prevents, since our little babies are growing, there's a lot of stresses in life with them, and coccidia is one of those big avenues that we have a lot of issues with, is just in general. And having those types of additives in our diet can prevent coccidial overgrowths, and really it can prevent a lot of detriments in our herd. The other thing is, we talked a little bit about it, is Bose. Again, if you're comfortable giving those shots and such, talking to a veterinarian and getting that plan set up, that would be where I'd go. It prevents a disease called white muscle disease, and it's basically just we overgrow, and the muscles just have issues. And from the standpoint of just the highlights of it, does affect the heart. The heart's a muscle, and it can lead to a lot of issues from that standpoint. Going on to our dry does and ewes, these guys are more of their maintenance. They're there. We're having them in the back. They're not showing. They're just kind of in dormant until breeding season. And really, what we need is just some sort of mixed grass, some sort of pasture if that's available, as well as we're trying not to overfeed them. And really, because overfeeding causes a lot of weight, and also it's a big expense. And with the overweight aspect, it can lead to issues with breeding in the fall, and really can cause a lot of if we're trying to breed these guys, if they don't breed, then the point of having these reproductive does is potentially for naught. Kind of towards the end, and when we start getting into that first rut season and that first kind of heat cycle, we do have that term that everyone likes to use of flushing, and it's basically kind of feeding some good quality food, good quality grains to get the organ, get the reproductive tract on goal, and kind of fire it up from that standpoint. For our milking does, again, this is kind of the goal is a little bit different. Coming from my aspect of the milking side is, milk is king. The more milk we have in that udder, the better we show. So we were feeding, very high quality forages, grain at both times of, milking, just to get these guys going, because if they don't get the correct nutrition, they will start pulling nutrition from the bones, pulling nutrition from their fat, and they can lose a lot of weight if they are those true producing does. And also it kind of goes on to the dam raised kids. I know we have some board breeders out there. If we have it's still the same thing. If we're not feeding those guys nice quality grains or quality haze, then our little babies that are on the dams are basically, a parasite, and they're pulling away from that doe, and the doe has got to make some compromises that, could be easily avoided if we did some very nice quality alfalfa or quality haze. If you had to twist my arm, I mean, grains are great, but our forages are kind of the top tier. That helps really well. The forages work well in the rumen. We can have, the classic terms of grain overload, rumen acidosis. Those things do occur if we have just a more grain diet than a alfalfa diet or a hay diet. So definitely lead with our forages and our legumes more than just kind of doing an all grain aspect. For our pregnant does, this is kind of on the same part as our milking does, except we think about just the aspects of, we have now, instead of having our baby on the outside, we have the baby inside. And if you think of space occupying, there's not much room to go around, especially with our late term pregnancy does. So making sure we have really high quality, this is, I would say high quality is where we need to be at for these guys. Grains, alfalfas, again, more hays than grains, because if they're eating and the rumen's this big, now they have a baby and it's this big, and so if they can get that easy to digestible, high quality food, they're not spending a lot of time trying to digest it. It's in there, it digests, it goes out to the body, goes to the baby, and we avoid having the doe trying to eat more to get that same nutritional value than just us supplying a good aspect of it. Again, I'm not a sheep owner, and if we do have sheep owners out there, forgive my goat heavy, doe kid. I will try and use some lamb and some ewe and sheep aspects there, but be aware of your copper. That's the big thing with our herd and our nutritional aspects is look out for that copper content. Make sure we don't have any, we don't overdo it, because that can definitely lead to copper toxicity. And that's kind of, sheep people know that, and we'll stop it there. Going on to more herd management, this is the vaccines. This is that core vaccine that we talked about earlier, the CD&T. It's Clostridium C and tetanus. It prevents enterotoxemia CD, and that's where you get your T at is tetanus. And this is where we start about 4 weeks of age. We give them a shot, and then about 4-ish weeks later, we give them another shot, and it's a booster program. And this prevents enterotoxemia, which is overeating disease, and that can happen with any goat, any perfectly normal boar, dairy goat, pygmy, anyone that's like normally at the kid level. Unfortunately, it's the clinical signs are they're the best goat in the barn, the best kid in the barn that's eating, growing like a weed, doing all this thing, and then the next day they're dead as a doornail. That's kind of what we're looking at. So getting this core vaccine on definitely helps. I know there are some aspects of vaccines some people are a little weary about, but this is our core vaccine that we need to make sure we get on board for these guys. Especially with everything in farm aspects is, we have wire, we have the hog panels, we have the rusty T-post out there. That's tetanus. That's tetanus in a nutshell. So having that vaccine on board helps with our younger ones and also our mature does. So giving an annual vaccine definitely helps. We try to do about 2 to 4 weeks before we give birth, if we're doing that aspect, or really just doing it as an annual vaccine for our little ones, or as our bigger does. And then for Bose, the jury's kind of still out. A lot of times with Bose given to our late-term does, it can cause maybe an abortion or so, or early pregnancy or early delivery from that standpoint. So I normally tend to not recommend doing that until after we're kidded or lambed and we're kind of we're in our plateau of one of like this column or even into our dry doe column is when we'd give that. Kind of continuing on with the herd management aspect is talking about diets and making sure we keep an adequate diet. We keep that good foraged or our mixed foraged or just our pasture management based off of our goals. And that's really comes down to you guys as the producers is what goals are you trying to get and where to get where to go from there. Really big things are making sure we supply fresh water and trace minerals and salt. Jury's kind of out on salt blocks and like mineral blocks. I don't know really from a standpoint of I've used both, and I've also used free choice scoop, like it is loose mineral, loose salt. I feel like it's a lot easier for the does to get that mineral in them if it is loose. If you have we have a little 2x2 little box, and we basically mix the trace mineral in with the mineral salt, and we put it in there, and they nibble at it right next to the baking soda, and that seems to really it makes sense from the standpoint of energy expenditures. If you're licking up, if you're just sitting here licking a block, do you really get a lot of minerals from a goat walking over and just biting the loose mineral, or just kind of picking it up with their mouth from that standpoint? I feel like it definitely helps, and they're not wasting a lot of time. Now, granted, I still have a salt block out there, and they still lick at it, but they still go to that free choice mineral and scoop some of that up as well. So I do like the trace minerals. It helps in prevention of um, poliocephalomalacia, which is basically a thiamine issue. It can really help with that, and that's kind of the cherry on top with our nutritional health. Again, going on to keeping a clean, dry, ventilated house decreases ammonia. We don't have that ammonia on the ground. I mean, if you had issues or if you're concerned, get on their level. Lean down and either get on the barn floor and just kind of smell. If you smell that kind of acidity, then we probably need to clean that pen out. It definitely helps with keeping a dry pen. Helps with a lot of foot problems like foot rot and moisture-based bacterias, and really it definitely can eliminate those problems. Going to the feeders, I like having the feeders above the ground, and the reason why is they're above the ground. I try and keep them above their butt level or right at butt level, because pans on the ground, they paw in it, they walk through it. Goats are eating, and then one of them thinks that there's something greater on the other side, and it runs across the pan and knocks it over. You're wasting feed from that standpoint. Also, from the parasitism standpoint, you're looking at decreasing your fecal oral transmission while having the feeder up above the ground. Their mouths go in, and that's it. Now I know some of my goats back home, they find creative ways to get in the creep feeder and poop in it, yes, but you can scoop it out, and really it decreases a lot of the foot traffic through those areas of feedings, and that's kind of what we're trying to cut, is that fecal oral transmission. And really what that means is basically fecal matter going into your face, and that's kind of what, if you think about it, goats don't use the bathroom. They're walking around where they go to the bathroom at, and so those feet go everywhere. And if they're walking through the pans, it definitely can cause a lot of spread on that aspect. Trim the feet, with the hoof trimmers that we talked about in our first aid kit. That monthly, sometimes a little bit sooner, sometimes a little bit later. It just depends on, are they active? Also, if you're showing and such, you want to make sure we keep those feet trimmed, because it does help with walking and gait. And also with that trimming of the feet, it can decrease that kind of fold over, where if the hoof folds over on itself, it traps whatever it traps in there, and that normally is a perfect breeding ground for a lot of our bacteria that can lead to foot rot and whatnot. The kind of final 2 points are a little bit more, I would say advanced, but keeping records is definitely a basic one, and that's something that we want to make sure we do. Breeding dates, birth dates, tattoos, vaccination history, and have those on file. I know some people have registered goats, some people don't, but still, I mean, and even some have just the normal tag that says, hey, that's yellow 13 out there, and that's what they know, and that's how they can record. Nothing frustrates, I would say, a veterinarian more than not having a thermometer, but also not knowing what animal is actually sick. And that when you come out there, or when you have the veterinarian come out to your farm, and you're going through and you're trying to find what goat's truly sick, and you get confused on, well, I thought that was J something and this was actually A, and it does frustrate a little, because you are paying for the veterinarian's time, and that's how a lot of farm calls work. So if you have those records, you're going to save yourself a lot of time, and that time is going to be what pays the veterinarian. So if you can cut that down, it's going to cut your bill down as well. So making sure when they get out there, having your records situated, your tattoos, your vaccine histories, and whatnot. The final point down here is kind of for the dairy goat aspect. It's for kind of all small ruminants. I mean, this is testing of tuberculosis, brucellosis, Johne's, and the CAE, and this is for your program. If you're going to be doing showing and going around there, or even breeding a lot and selling, you want to make sure you have these tests done. Talk to your veterinarian. I'm not going to say everyone needs to do it, because it depends on what your goals are, and that's something that getting that conversation started with your veterinarian will help. in that aspect. I know for the milking does of the dairy world, the dairy goat world, like CAE is one of those that a lot of people pay attention to. And yes, there is tests out there. You draw some blood, you send it off, and you go from there. Those are the aspects of keeping your herd clean, and that's kind of what goes into our next point is the closed herd versus like the sale barn deals. And this is where I think a lot of people get, I guess, into like the sale barn deals of, hey, I went to the sale barn, I got this goat for $50, or I got this sheep for $50. It looked great on the outside, it was really stocky, it was really good, everything was really, body condition was ideal to the T's. You bring the the ewe or the doe home, and it just starts, they're doing fine, but everyone else around them is kind of slowly dipping down. And those are aspects of, potentially we brought something into our farm that we didn't like. The difference between like a closed herd is, it's closed. I mean, it's pretty self-explanatory from that standpoint of your goats are in a confined area. You don't have goats coming over to get bred. You don't leave, you don't take goats out to go get bred or sheep to go get bred. Everything's kind of self-sustaining in its own little property there. And the big thing why I talk about that is you can bring in some pretty nasty diseases. CAE and OPP are kind of the two big ones on the goat and the sheep world. CAE, Caprine arthritis, and encephalitis is kind of the breakdown of that word is goat arthritis for our older does. It can cause, or even our middle-aged does, can cause arthritis to the point of basically we talk about euthanasia because they just can't get up. They're just poor doers. The joints just swell up like balloons. They don't do well. The encephalitis part is actually brain swelling on the little kid side. If we have a big rampant aspect or a big unchecked population of CAE positive does, that can cause some issues with our younger stock. Ovine progressive pneumonia is more on the aspect of a viral disease that, both of these are viruses, by the way, but it's a viral disease that is very contagious. It causes a chronic / continuous pneumonia, and it's a poor doer. They just don't do well. They don't grow. They're always sick, etc. The other thing about bringing in stuff from the sale barn is parasites. Our left column here, we have Haemonchus contortus, we'll talk about a little bit more. The barbed poorworm is kind of its trademark name. Down here is coccidia, and this is something that can be triggered by stress. Also, it can, theoretically, coccidia is in every goat and every sheep. It's just at a low level that the goat or sheep fights off. Obviously, we still treat it and we lower that number as best as possible. But from the standpoint of you can bring this into your herd, sure. Also, different parasites are, tapeworms, different types of, roundworms from that standpoint, like brown stomach worm and such can be really detrimental to herds. The other one that a lot of people have seen is ORF or sore mouth. This is kind of a trademark little lesion. You can see it around the nose, sometimes in the ears. It's a virus that spreads like wildfire. It's not as severe as these guys above it, but it is something that if you are showing or breeding or stuff like that, that can be a year ruiner. It can definitely ruin that aspect there. The other one is kind of jumping down here is CL. That's kind of what everyone's really scared of when they see abscesses and whatnot. So kind of going back to vaccine history, we do see every once in a while with vaccines, you can have like injection site sores and such. So knowing where you gave your injection can prevent some scares. I've seen some people that give vaccines down in this area and they've actually festered up, and then they got really nervous that, oh my gosh, we have CL, like this is bad. And CL is something that on a farm is basically, unfortunately, it's game over. Normally, a lot of times it's spread throughout the whole herd. These red marks are where the external lymph nodes are in our goat, but there are internal lymph nodes. So the fact that we don't know what they look like inside is where that leads to the game over part, is we don't know. And that can be something that has a lot of herds completely call out. I don't see a lot of it. I haven't seen a lot of it in my short time of practicing, but it is something just to kind of keep in the back of our heads if we do have those swelling of the lymph nodes and such. Down here is border disease. This isn't our sheep. It's kind of it's hairy shaker disease is kind of the trade name or the generic name of it. It's a sheep disease I haven't seen. It's more in Europe and such, but it is something that we kind of, we got to be on the lookout from that standpoint. The Johne's disease is the other big one that we like to talk about, and there's a test for it to kind of positive versus negative. It is a reportable disease, and again, it kind of goes on to the CL aspect. Is normally if you have that on there, it is kind of a game over for your herd. And then this one is Q fever. The only reason why I have on this is Q fever. I did a little bit of research myself. We wrote a paper about it, and Q fever is another bacteria that can be transmitted through placenta, milk, feces, urine. It kind of can go. It really does whatever it wants. It is a zoonotic disease, and that's something that making sure. I know going back to our first aid kit. I didn't talk about it, but having gloves, latex gloves, or if you're latex allergen, latex-free gloves, OB sleeves for when we're doing those, those kid or lamb pullings and helping with the kidding process. Making sure we have that. That helps kind of decrease the barrier from that standpoint. And then scabies is and a lot of people are probably part of they have their herd ID, the scrapie ID number. That's basically just for, it's that prion that we all talked about. It's not as, it's similar to the mad cow disease that we had back in like the early 2000s, but it is something along those lines. That's why we have those ID numbers, so we can, track these animals in case something does occur, because it is another reportable disease that is very detrimental to herds. Not saying, I'm not trying to knock sale barns. I mean, our herd was started on a sale barn goat. So it is something that, if you do bring goats in from the sale barn, make sure we quarantine them. If we have questions, let's make sure we get those blood tests done, talk to your veterinarian so they can kind of plan your approach, and also, what is the goal of this animal? Like I said, we started with 2 goats that we bought from the sale barn, and that happened, and that's what we did. And then from there, we kind of grew off of that. So there are foundations from that standpoint. I'm not knocking any sale barn out there from this conversation, because there are some really great ones out there, but it is something just to be aware of. You could be bringing in something that could ruin your 4-H project or ruin your, kind of herd in general. This is Haemonchus contortus. This is the barbapore worm. This is I like talking about this worm because it never gets old. It goes. I see a lot of it when I was at U of I for veterinary medicine. When I doing my externships and such, that was kind of the big worm, or internal parasites in general were the big things that cause a lot of our first aid or those vet visits, and that's something that we need to kind of talk about from there. This is the barbapore worm, as we talked about, is the most costly parasite in the United States by far. It is something that when we see this, it is definitely hard to treat. It is seen in warmer areas. Supposedly, the rule of thumb was it was below the Mason-Dixon line because of, we didn't have a true hard frost. But I'm sorry to say that there are Haemonchus worms in Indiana. There's some in Illinois. They're there. They're definitely present. And so we need to be armed with the knowledge of it. And from that, we need to make sure we eliminate routes of transmission, as we kind of see down here. This is the fecal oral transmission. Goat, sheep, lamb eats the egg. Worm is in the worm is in the goat or the lamb. It reproduces. It kicks out its eggs into its feces, and then the whole cycle starts over again. So treatment is what we talked about at the very beginning of having those 2 different classes of dewormer, making sure we treat the ones that are unthrifty, and that can be determined by our Haemonchus card. And this is a program at the University of Georgia. I have the link down here that if you guys want to do, I think it's like $50 that you can put in, and you basically get trained in identifying what anemia looks like in our sheep and lambs, what you would look at is the under eye of the lid, as you can see in this photo here, and you determine that redness on our scorecard here. The scorecard is basically based off of 1 being great, 5 being severely anemic, aka we need to call a veterinarian or we need to get to a vet clinic as soon as possible. 3 and 4 are kind of in that area of we need a deworm, and the Haemonchus system is basically determined to deworm the ill ones and not deworm the whole herd, because sometimes when we deworm the whole herd, we can cause some resistance, and there are proven resistances in our dewormers for Haemonchus contortus. Some extreme signs besides looking at our scorecard here is bottled jaw, and this is what this looks like down here. It's the pooling of fluid in our skin, and that basically tells me that we are so anemic that albumin is low and everything is leaking out of the vessels. All the good stuff that we need in our body is leaking out into the periphery of the sub-Q. So from that standpoint, kind of heading back to that pan, why we keep the feeders off the ground, we put them on the wall, so we can eliminate this kind of fecal oral transmission. The other 2 things that we like to do is rotational grazing. If we have pasture space, we use one pasture for a year, rotate to the next one, and go from there. The next thing that we can do is selective breeding. I know in the boar world there are people that have goats that are resistant to Haemonchus or have a higher tolerance to Haemonchus, and that's where coming from the breeding aspect is we need to make sure we're breeding the well-doers, the ones that are thrifty, they're doing well, they keep going, they're growing through all this adversity, and the ones that aren't doing well, we need to find a way to treat them. And if we are in that process of the meat side of it, we probably need to talk about calling and such. So it is keeping that aspect there. From that standpoint, this is kind of when in doubt to call your veterinarian. And from that standpoint, I like to say when owners call, I like talking about photos. We're in 2020 now. Everyone has an email. Everyone has a cell phone. They can take a photo and send it. I like that. It prevents us from driving out there for a false alarm maybe. Also, it kind of we are in that communicate. It kind of gets the communication going from the veterinarian standpoint. And I'm not trying to train anyone to be surgeons here. There are severe issues from if we have a puncture wound that it looks bad, call. Don't think about waiting 4 to 5 days and then it festers up into something worse where we could have been able to manage it sooner. Those are kind of the aspects of you guys know your goat's best and lamb's best, and if you think something's wrong, give us buzz. Nothing, it is something that I love getting phone calls from owners and such. It's just if you're armed with the knowledge of what to present to me, I can make that judgment call and also help you guys out in the long run. Instead of, sometimes if owners call and they're just like, "Oh, doc, the sheep's not doing well." It's like, well, why is it not doing well? Well, it's not doing well. Okay, great. And that kind of, it can really sour the mood from that standpoint. But if you call and tell them, hey, I got a fever, or if I got a puncture wound, here's the photo of it. Or, hey, this is the foot, and you pick up a foot and you take a photo of it after I trimmed it up. Is this, a foot rot, or is this, a puncture wound, or is this an abscess? So those are aspects to help with, information gathering is really the big thing. For the people that are wondering where to find a veterinarian if they haven't found one, this is a really great organization. It's American Association of Small Ruminant Practitioners. They have a Find a Vet little blurb that you can look in areas that are registered with it, with small ruminants. And then they also send out like a really nice, I don't know if you can see this, but it's a nice little pamphlet. It's Wools and Waddles. It's a really nice newsletter that talk about, different aspects of treatments and kind of herd health, herd management, and whatnot. So that is kind of the end of my presentation. These are kind of my references. For the veterinarians out there that you guys are dealing with, I would highly recommend getting one of them these books, or make sure they have this book. It's the Sheep and Goat Medicine book by Dr. Pugh. It's the small ruminant. I like to say it's the small ruminant Bible It's my go-to. I love it. I have it with me wherever I go. It has a lot of treatment plans, has medications, has kind of the run-of-the-mill of everything. The other resources that I had is the ATTRA via the NCAD. They have a really cool podcast I was listening to while preparing this lecture, and they have some really good resources there that help out with talking about herd health, and they talk about everything with sheep and goats. So it's something I would definitely get a look into. Also, Purdue Extension has a very nice article about the common goat diseases, some that we did not talk about today that we can talk about, and they cover it there, as well as the final one is this wormx.info. This is the Haemonchus scorecard that if your veterinarian is curious about it, I would say definitely get them to sign up for it. Or even, I don't even believe you have to be a veterinarian to do it. I think you can, because I did it in vet school, so I wasn't even a veterinarian then. So you can technically do it as just a practitioner, and you can get certified. They ship you the card and everything that you can use your herd. And it's another tool of information gathering that will kind of help with the veterinarian make those tough judgment calls. Okay, I think I am done there. Thank you guys so much for letting me present to you, and hopefully I didn't lose anyone, and also just stay safe out there with the world. And I wish we could do this all in person, because this would be a lot better. I don't know why I don't like talking just to my computer screen, but thank you guys so much.
Thank you, Dr. Hubbard. You did a great job. So let's go through some of the questions that people have asked. So the first question, your position on hay plus a protein tub, multi-species feeds and minerals.
I don't have any brands off the top of my head. I normally would say if you have a good relationship with your feed rep or your feed dealership, they should have a very well balanced mineral. I personally like that. Hays, yes, you can pay $25, but I don't even know what the going rate for alfalfa is right now. But you can pay a pretty penny for some of that stuff, and I wouldn't say you need to go, oh my gosh, invest in all of that. I would say make sure you have a very good quality hay. We have alfalfa hay, but it has clover, it has timothy in it. Those are some good forages that we're looking for, not just straight grass from that standpoint. The protein tub, I've never actually, I think I need to look into that. I would say from a standpoint of, I know they do sell the mineral tubs that they can lick at. Sure, I would have no problem with that. Make sure if you are, I don't know if you're a goat or a sheep breeder, just make sure if we are a sheep breeder, make sure we look and make sure there's no copper additives or anything like that.
Thank you. Next question is, what is the normal temperature for a sheep or goat?
101 sub 103 is kind of a range. Every goat, everyone's a little bit different, but normally I start getting nervous if we start pushing that 103 mark and above. That's kind of where I'd be a little concerned about.
The next question, what if you don't know the vaccination history of animals?
Great question. Really, from a standpoint of if you don't know, and I don't know how long you've had these animals, I would say, doing a CD&T shot still is not going to, it's definitely not going to hurt them. If you think that there is the slightest possibility of them having vaccines on board, then I would say, wait a year and then give them the vaccine. If you're talking about the kid route, then I would say, waiting about 4-ish weeks of owning them and giving them another shot would be kind of the, giving them the first shot and going from there would be kind of the catch-all. If you can talk to the previous owners, I would say that would be the next step is, talking to them and making sure, or reaching out to them, make sure they have have that history if they do, and kind of go from there.
Next question. I'm feeding Shetland sheep orchard grass 2/3 to 1/3 alfalfa, wondering if this is good. I have 3 adult ewes and 9-month-olds, 1 wether and 2 females. I did not know they could overeat and get fat on hay. I cut way back on grain to nearly none per day. Body condition score gained.
That's a great question, because I like the blend. I mean, orchard grass, alfalfa. I mean, that's great. I have no concerns there, or I'm not, from that standpoint. From the grain aspect, I mean, that's kind of it is carbs. I mean, that is a quick way of doing, adding the weight on. I would say, from the question, just making sure I repeat it, we're gaining weight from that. Is that what the question was, Sarah?
That's how I'm interpreting the question. It's not quite clear.
Okay. I mean, if they're gaining weight from the hay, I would just make sure we don't get too overweight. It is something that, from a standpoint of hay and such, yes, they can get fat on that. So maybe rotating, I wouldn't say decreasing it, because obviously they need to eat something, but I would say if they have pasture, maybe promoting that a little bit more than just getting hay, because if they're not going out to the pasture and expending that energy to go out there, they're not going to want to, if they just know, hey, I get hay in there, I'm not going to go out to the pasture. They're not going to, they become sedentary from that standpoint. So I would say, make sure we promote that pasture grazing if we have allotted areas for that. I think that'd be great. But I like the grass blend. That's a pretty good one from that standpoint.
Okay, next question. Are goat dewormers safe for sheep?
So that's just me using, that's my bad for using the terminology of just, I think I said goat dewormers. Yes, the macrolides and the fendibendazole are yes, they are safe for sheep as well. That's just, I think, my terminology using it wrong. But yes, that is, they are both, I use that word interchangeably, and that is my bad I know we have sheep people here, and I should change my terminology up, but it's such a hard habit to break.
And actually, I'll interject on this one because I am a FAMACHA trainer and familiar with these products. And actually, there are very few products that are labeled for goats. There are actually more that are labeled for sheep. And those that are labeled for goats are also labeled for sheep.
Right.
And the wormx.info site that Dr. Hubbard referenced is a great resource for information on dewormers. And they do have a chart on doses for goats and sheep for all of these dewormers on that website.
There also is a chart and dewormer in the sheep and goat medicine book. So if your veterinarian has that, he should have kind of all the resources he or she should have to their disposal.
Okay, next question. How important is copper for goats? I ask because I have both sheep and goats.
It's not, yes, it's important, but it's not like a fundamental building block. I know there's sometimes that people, you can read online and like copper will help with hair growth and all that. And sure, I more or less, every balanced diet should have enough, it should have copper in it. If it does, if it's a sheep diet, then it should have that labeled. That's why they're labeled for those respective breeds, or species, because, I'm more worried about the copper toxicity more than just having copper on board. So I don't touch the copper situation because every grain's a little bit different, every supplement's a little bit different. So if you have both of them, if you have both sheep and goats, I would say just kind of whatever you're using obviously is working, because you probably haven't had a copper toxicity dose issue. So I would say, if it ain't broke, don't fix it from that standpoint.
Next question. Can one use a thermometer gun? And if so, where's the best place to point it?
A thermometer gun. I've actually never used a thermometer gun on a goat, or a sheep. So I don't know, actually. I would say it would be, I think it would be fine. If you used it like behind the eye, like on the temple area, because you don't want to do forehead because it's a sinus. There's a big sinus that runs kind of right next to the eye, so you'd get like probably a lower reading. But I don't know, since 2020 and now all the thermometer guns are out there, I would still be pretty weary on it. I would definitely, rectal thermometers are the go-to. I know they have digital ones and mercury. I mean, I had a veterinarian that she has a mercury thermometer, and that's what she swears by. Great. If it is something that, you go to CVS and get just a, human thermometer and use it for rectal temperature, just make sure you have that isolated into your own, the goat first aid box and not yours. And I think you should be fine. But I would prefer a rectal over the thermometer gun. But I never even thought about that question.
Okay, next question. What is suggested for pain medication for use after C-section, hard pull, etc.?
Gotcha. So go-tos would be if you have issues. Again, I don't know, going back on veterinarian-wise, I guess I was a little bit blessed. My father, who was also in this reference, Dr. Steve Hubbard, we had Banamine on board, so we were able to give that. That is something I would do. It's an injectable. You can give it IV or intravenous or intramuscular. The other ones would be if you are, if the ewe or the doe is eating, then I would say meloxicam would be kind of the next one I would use. The big thing about meloxicam and such is it's more of a pill, so making sure that the ewe only eats that and make sure we monitor so no one else eats it, because the concentration for meloxicam is definitely different than a dog or a cat would. Is actually pretty toxic. So if you have those barn cats or those barn dogs, make sure if we are giving those oral pills, make sure that they are going solely to that animal, because they can mess up a lot of GI related issues to our younger, our non-ruminant patients.
Okay, next question. Thoughts on sheep anti-abortion vaccines?
I guess the question is are you thinking that the vaccines cause the abortions, or are we looking for?
My guess is you're probably asking about a chlamydia vaccine or something that's targeted towards preventing abortions.
Right. Okay, perfect. Yeah, I would say if that, again, that is something that you can talk to your the veterinarian about a plan. I personally have never used that vaccine. I know it's out there, and if you are having those issues, or if you've been exposed to those issues in a herd with sheep, sure, yes, I would say get those on board. A vaccine, again, is something that it's not 100% effective, but it definitely drops that risk down from that standpoint. So I would highly recommend, if you have those issues, then yes. If you don't have those issues, then I would say you probably don't need to really focus on that vaccine protocol. But again, that's having an open conversation with your veterinarian about like your goals and aspirations of what you're trying to get out of this livestock, and also if you had those issues or those risks before, making sure that we we're clean and open with the veterinarian, because nothing frustrates us more than getting a curveball from something that we forgot, or something like that. So I would say if you have those issues with abortion, get that vaccine on board for sure.
Next question. Did you say that yearly pasture rotation would be sufficient for worms prevention?
It helps. It's not a sole prevention of it. Prevention in my mind is 0 cases. And going back to this little guy, going back to this photo, if we truly have enough pasture to isolate it, I would say great. Yeah, you definitely will have a decrease in worm burden, but we do need to make sure we have this card on and on hand so we can look at our sheep and goats. Also, doing deworming. I know some people have a philosophy, if your herd's small, they just kind of do a broad deworming. I'm not a big fan of it, just because of some of these worms being resistant to our dewormers, but it is something that with specific dewormings on certain animals that aren't doing well, along with pasture rotation, definitely helps. I think that would be the kind of the gold standard from that standpoint. But solely, I would say you're rolling the dice, just because I know a lot of times with certain winters, especially I don't know where you're located at. You know, if it's a mild winter, did they all really get frozen off? And you know, and so you're really asking a lot of other sources besides, you know, a veterinarian or yourself going out there and deworming a goat or a sheep, and you know that it got dewormed. So I think solely no, I would, but it definitely helps with everything going on.
So for more information on parasites in sheep and goats, we did a webinar on this back during the summer. So if you want to go to my YouTube channel, you know, you can find the recording of that webinar with a lot more detail on parasite management and prevention of sheep and goats.
Mm-hmm. I just mostly talked about it just because it's one of the most common things that I would get farm calls or get called out for is goats that were, you know, decrease in weight, they're anemic and such. Those are kind of my big kind of why I get called out. So it's just something I figured I'd touch on, but I saw that in the Google Drive. It's definitely awesome to have that conversation. And also the WormX definitely looks, is a good website too.
One last question. What location do you suggest for IM injections in lambs?
So with that, normally you shoot for the, I don't actually have a, okay, so this is a goat, but normally you shoot for the little triangle area right here in front of the shoulder. That's a good IM injection. It depends on if your lambs are for meat and such. A lot of times people say give it back here in the rump. If it is a market lamb of some sorts, that can compromise your carcass quality and such. So normally they tell you to put it in some area that's not a high value meat area, which would be up here. Kind of, if you feel down the neck, you should be able to feel right in front of the shoulder blade. There should be a nice, like, juicy area to poke into.
Thank you, Dr. Hubbard. I think this was a great webinar. And
thank you so much.
Thank you, everyone, for attending. Please